name's Faith. I'm your student nurse today. I'm going to be doing a head-to-toe assessment on you as well as some health history questions. Can I ask you what your name is?
Sarah Smith.
And your date of birth?
2/15/2001.
And what city are we in?
Saginaw.
Perfect. And then what is the year?
2022.
Perfect. So I would call you alert and oriented times 3.
Okay.
So we're going to start with some health history questions first. Do you have any medical diagnoses I need to know
No.
about? And then any previous surgeries you've had?
Nope.
Any recent hospital visits?
No.
And then do you take any medications?
No.
And then do you use any herbals or supplements, anything like that?
No.
Okay. And then do you smoke?
No.
And do you drink alcohol?
No.
And then how would you describe your diet?
Healthy.
Okay. And then what about some exercise? Do you do exercise?
Usually like twice a week.
Oh, okay, that's good. And then can I ask you if you have any allergies?
No.
And then any pain?
No.
Okay. Is there anywhere specific you would like me to focus on in this assessment?
No, I don't have any concerns or anything.
Okay, perfect. So I'm going to be starting off with some temperature and looking at some lesions and that kind of thing.
Okay.
Sorry about that. So I'm going to check for temperature, muscle symmetry, and tone. And then I'm also noticing some freckles. Do you have any issues with your freckles?
No, I've just always had them.
Okay, any skin cancer that runs in the family?
Nope.
Okay, perfect. And then if there's no bumps or anything like that, so I'm going to take your brachial pulse. Noticing symmetry in that. And your radial pulse. That's good as well. And I'm going to check your hands. I'm looking at your hands and noticing any clubbing. And then we're going to take capillary refill. Perfect. That's less than 3 seconds and it's both symmetrical. If I was in a lab, I'd put a pulse ox on you and check your SpO2, but we are not in that, so I would expect it to be around 96 to 100%. And then as well, I would also take your temperature, but I do not have a thermometer, but I expect that to be around 98.5 as well. So first I'm going to go ahead and take your blood pressure.
Okay.
And then I'll do your heart rate and then your respiratory rate.
Good.
Okay. Do you have a preference of which arm?
No, either is fine.
I'm going to do your right. Okay, your blood pressure is 100/56. Is that about normal for you?
Yeah.
Okay, perfect. Let me take this off. Sorry about that. A little sticky. And while I'm down here, I'm going to take your heart rate.
Okay.
Maybe cross your arm over. Perfect, thank you. Okay, your respiratory rate is 16 and your heart rate is 80. Is that about normal for you?
Yeah.
Okay, perfect. So after that, I'm going to head up back to your shoulders.
Okay.
And I'm going to be checking for some range of motion as well as the cranial nerves.
Okay.
Okay. So first I'm going to start with cranial nerve. I'm going to have you shrug your shoulders up.
Okay.
And then can you reach up and
Sorry.
down and then shrug them up again? Perfect. That's testing cranial nerve number 11, which is your accessory muscle. And then I'm going to go ahead and check for range of motion. So I'm going to do a forward motion. Would you rather me do both arms at the same time?
Both is fine.
Okay, all right. Just noting for crepitus, which is grinding. And you can go ahead and start. I feel some crackles. Is that normal for you?
Yeah.
Okay, and then backwards. Also some crackling in there, and also
Normal, yeah.
Okay, all right, perfect. So I'm gonna have you do this with your arms, and then out again, and then in. Okay, then range of motion. So we're gonna do out, and then in, and then can I have you squeeze my fingers? And then we're gonna be doing some restriction tests or resistance tests. So I'm gonna be having you put your arm or hands out like this. Can you push up, and then down, and then we'll do this and push in, and then out. Perfect. So you do a finger test and then that. Okay, so I'm going to move down to your legs now, okay? So I'm going to bring this up here and check for your patellar reflex. Test this one more time. Perfect. Can I have you both kick out your legs at the same time? Or it doesn't matter. And then I'm going to check your capillary refill. Noting it's less than 3 seconds. It's also symmetrical. Then I'm also going to have you go with your range of motion outwards with your feet, and then inwards. Perfect. And then I'm also going to note temperature as well as muscle. Okay, that looks pretty good. I'm going to move up to your head now, okay? So I'm just going to be looking in your hair. Do you have any issues with your scalp?
No.
And then do you dye your hair?
I do.
Okay, and then are you noticing any tenderness, any pain when I do this?
No.
Okay, I'm noting for symmetry. Okay, and then do you have any headaches? I'm not sure if I already asked you that. But
No.
okay, all right, and then I'm going to go ahead and feel for your occipital lobe, and then your postauricular, and your preauricular, your submandibular, and then your submental. I'm going to go down your cervical chain. Then I'm going to have you shrug your shoulders up.
Okay.
Then I feel for supraclavicular. Sorry, that's a little tight. And then also going to test your tissue turgor down here as well, looking for tenting. If you had tenting, that would mean dehydration, but I do not see any of that. So I'm going to go ahead and move on to the ears.
Okay.
I'm just looking in there for, actually I'm going to feel first. Temperature is symmetrical. I noticed you have some piercings. Did those heal well when you got them? Okay, perfect. And then how long have you had those?
Bottom ones I've had since I was like a baby, and then top ones I've had since I was probably like 13.
Okay, perfect. I'm also going to check, make sure that they're, these are frequently missed when you have sun, when you're out in the sun, so make sure you're putting sunscreen on those. Then I'm going to look inside as well. Looking for any earwax. I don't see any. It's very good. Same on that side as well. Okay. I'm going to move on to your nose now, okay?
Okay.
I'm going to put this back. It's probably comfortable. So I'm going to inspect first, make sure there's symmetry. I'm going to feel your frontal sinuses. Is there any pain with that?
No.
Maxillary, any pain with that as well?
Nope.
Okay, and then I'm going to be looking inside your nose, okay?
Okay.
I'm going to be looking for polyps or a deviated septum, as well as pink and moist. I'm just going to pull up your skin a little bit. Looks pink and moist. I don't see any polyps or a deviated septum, so that's really good. And then while we're here, we're going to check your olfactory sense, which is cranial nerve 1. So I'm going to be asking you to smell this.
It smells like lavender.
Yum. So after that, I'm going to go ahead and go to your eyes.
Okay.
So we're going to be testing your cranial nerves for that, as well as I'm first going to check your sclera.
Okay.
So I'm going to pull down and have you look up. I'm going to pull up and have you look down. Okay, looks really good. So now I'm going to look for corneal light reflex. So let's see when your light hits. Okay, perfect. Then I'm going to look for direct and consensual on your pupils, okay? Just looking for constriction. Perfect. Okay. Now I'm going to be looking, your pupils are equal, round, reactive to light, and accommodating, and we're going to test that one right now. Can I have you look here, and then look at my hand, and look at back at my hand like, okay, perfect. So now I'm going to have you look here. We're going to test the cardinal fields of gaze, which is also your cranial nerves 3, 4, and 6, okay? Just follow with your eyes. Alright, good there. So we're going to check your mouth now, okay? So I'm just going to look in equal for symmetry. Your lips look really moist. Okay. Do you have any fake teeth?
No.
Do you wear a retainer?
Nope.
Okay, alright, I'm just going to look inside. Can I have you open your mouth? Looks nice and moist. It's very symmetrical. So I'm going to test your cranial nerves 9 and 10 now.
Okay.
Do you have a gag reflex?
Yeah.
Okay. Alright, can you open your mouth? Look back there. Say ah.
Ah.
I see your uvula moving up, which is really good. And then can I also have you stick out your tongue at me? And can you go right, left, and up and down? Perfect. That's cranial nerve 12.
Okay.
And then I'm going to be going ahead and testing for cranial nerve 5.
Okay.
So I'm going to have you clench your jaw. Okay, very well. Okay, and then we're also going to test cranial nerve 5. Can I have you close your eyes? And I'm going to poke somewhere on your face, and you're going to let me know where it is, okay?
Left cheek. Forehead. Chin. Right cheek.
Perfect. And then I'm also going to be testing cranial nerve 7. So can I have you smile, frown, angry face, and puff out your cheeks? Perfect. Okay, so I've checked all your cranial nerves. I'm going to go ahead and look down here. I'm going to note for symmetry with your trachea and your neck muscles. Okay, now I'm going to feel for your carotid artery, okay?
Okay.
Check this one. Now I'm gonna listen to your carotid artery. I'm gonna be looking for a bruit that's an obstruction of blood flow. Okay.
Okay.
Okay. All right. That sounds really good. I actually noticed that I did forget something. I'm gonna go back down to your feet, and I'm gonna be doing resistance tests on your feet. Okay.
Okay.
I'm gonna be doing up, press up, and then press down, and then can you press inside, and then go out. All right. That sounds really good, or that feels really good. So your capillary refill, your legs, your arms, your neck, your eyes, your cranial nerves. I do all of your cranial nerves. I think so. So I'm gonna have you. We're gonna have you turn around, and I'm just gonna have you sit over here, like on the with your back towards me.
Okay.
That's okay.
Is this okay?
Yes. And is that comfortable for you?
Yes.
Okay. Just want to make sure. I'm gonna pull this one back a little bit under. Makes it that's okay. I'm gonna tie this one, and I'm gonna release the first one. So move this one. I'm just checking your spine. Making sure everything's okay. I'm actually going to go ahead and feel your thyroid.
Okay.
I'm going to move it over. Can you swallow? Move this one over. Can you swallow? Can you swallow?
1 second, I need more spit.
There you go. Sorry about that.
Very good.
And then note for alignment in your spine and your neck. Okay, all right, I'm going to do a chest expansion test, okay? So just take a really deep breath in for me. Okay, and then another one. Okay, there we go. So this is where your lungs end. So I'm first going to auscultate, and then I will do percussion as well, okay? And these are going to take some deep breaths for the auscultation, so if you need a break, let me know, okay? And then can I have you put your back a little bit? I'm just going to feel around your scapula. Okay. All right. Thank you. Big deep breath in for me. Actually, I'm going to change my bow. Deep breath in for me. Another one. Another one. Another one. More. Deep breath. And can I move your bra a little bit?
Yep.
Okay. And take a deep breath in. One more. Can you take one more for me? Perfect. I'm gonna go under now. Maybe take another deep breath in. Another one. You take one more for me. And one more. And one more. You take one more in for me. Thank you. So your lung sounds sound really clear, so that's very good. I was just checking for any crackles in the lungs. That would mean some fluid,
Okay.
but it sounds very clear. I'm going to go ahead and percuss now, okay?
Okay.
If this is painful at all, let me know.
Okay.
Move down your brow again. So those sound really good. I was also checking for fluid in the lungs with those as well. It wouldn't be resonance anymore.
Okay.
Anything else? And just check the back. Just want to make sure that I got all of those lung sounds. I checked the thyroid. Checking down here. Okay. So I'm actually gonna close this back up, but not all the way, and then I'm gonna have you lay down.
All right.
I'm just gonna be looking for JVD, which is jugular vein distension.
Okay.
And I'm gonna be looking for any bulging. If there was bulging, I'd raise the bed to 45 degrees. If there's not, then I don't have to.
Okay.
I'm gonna just look that way. Just looking for any bulging. I don't notice any. Can you look this way? And then that way. Okay, perfect. I don't notice any, so I don't have to raise the bed. So now I'm gonna give you the camera. Yeah. Mm-hmm. And then just don't touch the top, because that's the power button. Okay. Would you like a pillow behind your head?
Yes, please.
Okay. There you go. Is that comfortable?
Yep.
Okay. All right. So first, I'm going to be doing the heart sounds. So I'm going to be feeling. So I'm going to be counting intercostal space, and I'm going to listen to 5 places. But I'm also going to be listening with the diaphragm and the bell.
Okay.
So intercostal space 1, rib 1, intercostal space 2. So I'm going to be listening aortic first. I'm going to keep my hand there. Just listening for a lub dub. Okay. Keeping it on the intercostal space. I'm going to switch it. Listening for a heart murmur. I don't hear one. That's really low. So I'm going to recount again. Intercostal space 1, rib 1, intercostal space 2. So now I'm going to go to the pulmonic area. Listen with the diaphragm first for a lub dub. Okay. I'm going to switch that to the bell, listening for a murmur. I don't hear anything. That's really well. Intercostal space 1, rib 1, intercostal space 2, rib 2, intercostal space 3. It's right here. This is testing your herbs point.
Okay.
Listening for a lub dub. Listening for a heart murmur. And I don't hear anything. Intercostal space 1, rib 1, 2, rib 2, intercostal space 3, rib 3, intercostal space 4. If this gets a little uncomfortable, I'm going to be moving your brow a little bit here, okay?
Okay.
I'm actually going to reach under if that's more comfortable for you.
Yep.
Listening for a lub dub. This is your tricuspid valve. Switch it. I apologize.
Good.
Listening for a murmur. Don't hear any, so that's really good. Change it back. So I'm actually going to stay at this intercostal space. Feel for rib 4, rib 5. I'm going to walk all the way over to the mid-clavicular line. listen to your mitral valve.
Okay.
Listening for a lub dub. I'm gonna flip. Oops, sorry. Listening for a murmur. Okay. And flip back, and now I'm gonna listen to your apical pulse for a full minute.
Okay.
Okay, and there it was 76 for your heart rate.
Okay.
That was your apical pulse. So now I'm going to turn off this, and then now I'm going to, would you like me to put the camera somewhere now?
I just needed to set it down for a second.
Okay.
My hands are getting tired. I didn't want to
you're
drop
fine.
it.
You're fine. It's a little heavy. It's an iPad.
Yeah.
So I'm going to now pull this down. Are you okay with this being exposed?
Yes, that's fine.
Just going to pull this up here a little bit. Now I'm going to look for shape and symmetry on your stomach, looking for any bulges or anything like that. So now I'm going to be looking here. Looking for your aortic pulse. Can I have you take a big deep breath in? Okay, sorry, it's a little heavy.
Good.
So now I'm going to be listening to your aortic artery.
Okay.
Listening for a bruit again, for any obstruction. I shouldn't hear anything. And I don't hear anything. Okay, so now I'm going to go to your renal. Start here. I'm going straight across to the other one. Okay, now I'm going to be looking for your hip bone. Going in a little bit. This is your iliac crest.
Okay.
And those were your renals. Okay, those are really well. I don't hear anything. So now I'm going to be feeling for your femoral. I'm actually going to pull this all the way back up.
Okay.
And then we'll go down here instead. So again, I'm going to be feeling for your femorals. And then I'm not sure if you want to bring the camera up towards me. If you can. Sorry, it's a little bit of a bad angle.
Can you see it right there?
Not really. But this is what I'm feeling.
Okay.
On both sides. Are you comfortable with that? Is it okay?
Yeah, I just don't want to hit a side button.
It's okay. I feel the femoral arteries on both sides, and they're both symmetrical, so now I'm going to listen.
Okay.
And those would be your femoral arteries that I'm listening for, and I shouldn't hear anything again. Okay, so I'm going to palpate again. Okay, then I'm going to listen. And I shouldn't hear anything. I'm going to palpate on this side as well. Give me a palpate on, auscultate on this side now. Listening again. And I don't hear anything, so that's really well. So now I'm gonna pull this back down. Then I'm gonna pull this, or pull that down and pull this down. So now I'm gonna be auscultating your bowel sounds. So I'm
Okay.
gonna start in the right lower, and then I'm gonna work my way around.
Okay.
In this, I'm just listening for 5 gurgles
Okay.
each. Okay. First, I'm gonna start in the right lower. Okay, this is my upper. Left upper. And then left lower. Okay. So I hear all of those sounds, and your stomach is very active, which is really well. So now I'm going to do some percussion around here as well as to your liver, okay?
Okay.
Okay, and I was listening for timpani, which I heard. And I'm going to be going from to doll, okay?
Okay.
And it gets more dull as we go up, and that's to your liver.
Okay.
So now I'm going to do some light and deep palpation.
All right.
Okay, so let me know if you get uncomfortable at all.
Okay.
I'm going to start with light first. Noticing for any masses or anything like that. Is that uncomfortable at all?
No.
Any pain? Okay,
No pain.
Now I'm going to go into some deep, okay?
Okay.
Let me know if it's painful. And that's really good as well.
I had no pain or tenderness.
Okay, perfect. So now we're gonna move down to your legs, okay?
Okay.
So now, would you like me to put the camera back over there?
Yeah.
Okay. So first, like I said before, I was noting for temperature and anything like that, and I noticed it was really good, and then your muscle tone was really good as well. And so now I'm gonna look for edema, okay?
Okay.
Feeling edema. Okay, and then I'm gonna go back and listen. Feel for your palpate for your popliteal.
Okay.
And then your posterior tibialis, and then your dorsal PDS. I can actually feel those. I didn't expect that, but I can. And then to your posterior tibialis. And I can feel both of those as well. And feel for your dorsalis pedis pulse. And for all of these, I'm noting symmetry. And they're all very symmetrical. There we go. Okay. Now I'm going to go ahead and move on to a sharp and dull test for your legs, okay? And you're going to let me know where you feel it on your legs, okay? First, I'm going to tell you what sharp and dull is. This is sharp.
Okay.
And this is dull.
Okay.
Okay? I'm going to have you close your eyes during this, okay? So let me know what you feel and then where you feel it at.
Okay. Dull left thigh, or sharp left thigh.
Okay, good.
Dull bottom of left foot. Sharp top of right shin. Dull left top of shin. Sharp right thigh. Dull bottom of right foot. Sharp top of left foot. Dull top of right foot. Sharp side of left shin.
Good. Okay. That looks really good. You were able to notice all of those. So now I'm going to have you swing over to the front again. So I checked all of your pulses and your feet. anything like that. Would you like me to tie you back up?
Sure,
here?
thank you.
Okay, sorry about that. Just want to make sure you're comfortable. Okay, how are you feeling sitting up? Are you dizzy at all? Or
No,
anything
not
like
at
that?
all. I feel
Okay,
good.
perfect. So, I'm gonna have you put your tennis shoes on
Okay.
and your socks.
Thank you.
You're welcome. Do you need any help with those?
No, I'm good.
Okay. And then while you're here, I'm actually gonna look at my paper really quick. Actually, show the camera that there's nothing on here. Go ahead and run through. Okay. Okay, looking really good. So now we're gonna do the Romberg test, and then we're gonna do gait and coordination. Okay.
Okay.
So, actually, I'm gonna have you stand up first. Okay.
Okay.
Just making sure you're not dizzy or anything. So we're gonna test Romberg here, which is cranial nerve number 8.
Okay.
So I'm gonna have you stand there with your hands at your side and your legs a little spread apart, and close your eyes. We're gonna do that for 20 seconds. Just making sure there's no swaying or anything. If there is, it's okay, just a little bit. Okay, so I would say your Romberg is a negative, which is really good.
Okay.
There's barely any swaying going on. So now I'm gonna have you. Let's move the camera a little bit. Okay, I should see. Have you walk towards me, towards the door, just normally. Do you have any pain with that?
No.
Anything like that? No limping? Okay. And then I'm gonna have you do, let's see, heel to toe on the way back.
Okay.
Heel to toe. Any pain with that? Any
No.
difficulty? Okay, that's really good. Put this back here. So we're at the end of our health assessment, our head to toe assessment. I wanted to give you a brain scale of 23, which is really low risk. Your mobility is great. Your nutrition sounds really good. No friction in shear and moisture or anything like that. So it seems really good for everything.
Yay.
So yeah, you're welcome. So I'm gonna walk out of the room. You can get changed and everything, and you're on your way. Okay.
Okay. Thank you.
All right. Nice meeting you.
You too. Good job.